being in assisted living, does that actually reduce the risk of falling?
Well, assisted living, for the most part, or the type of care that is provided, whether it be in the home or in a dedicated senior community, really has to do with the amount of assistance that a person needs. Do they need assistance getting themselves dressed? Do they need assistance ambulating from point A to point B with either supervision or an assistive device or different things like that? So there isn't like a blanket answer to that question. But the one thing about safe balance, or even the multifactorial falls risk assessment, to intervention program, is it really kind of classifies, the level of supervision or maybe assistance that would be required. But most importantly, you have somebody who maybe has deconditioned, general weakness of the lower extremities, for instance. Maybe it's time to introduce a cane, previously that they haven't, and we've just decreased their risk. That doesn't necessarily making the jump to assisted living or anything like that. There's so many steps that, obviously can, be put into play. But assisted living facilities, for instance, we could be looking at, some of the highest fall risks there. So again, a sudden change, and obviously being able to detect that sudden change, provide the intervention, is something where, safe balance in and of itself can absolutely be critical to keeping them in their apartment in the assisted living facility or community, rather than into the emergency room or in the hospital, and obviously going from there.